Hello everyone, my name is Anne-Marie Anozie, an endocrinology clinical fellow. Today, we will be talking about thyroid cancer. We will talk about the risk factors, the symptoms, diagnosis, and the treatment of thyroid cancer and the follow-up. What is thyroid cancer? Thyroid cancer is a rare type of cancer that affects the thyroid gland. The thyroid gland is a butterfly-shaped gland that sits at the base of your neck. It is an important gland responsible for producing hormones that control a lot of vital functions in your body, such as your heart rate, your blood pressure, body temperature, and your weight. Thyroid cancer happens when there's been a change to the DNA inside the thyroid cells, and this causes them to grow in an uncontrollable fashion and produce a lump. Sometimes, these cells evade the nearby tissues, such as the lymph nodes in the neck. They can spread or metastasize to other parts of the body. Risk factors. It is not usually clear what causes the change in DNA, but there are a few factors that can increase your risk of developing thyroid cancer. And these are presence of family history of thyroid cancer, previous exposure to radiation, for example, radiotherapy to the head and neck, especially in childhood. Women, thyroid cancer is 3 times commoner in women than in men. Other thyroid conditions, such as inflamed thyroid or the presence of a goiter. The incidence of thyroid cancer have gone up due to new technology that can detect small thyroid cancers. However, most thyroid cancers are treatable, and the prognosis for most patients is excellent. The types of thyroid cancer include papillary thyroid cancer. This is the most common type of thyroid cancer that affects people aged between 30 and 50 years. Follicular thyroid cancer accounts for about 15% of thyroid cancer cases, and it affects older people above the age of 50. Medullary thyroid cancer is uncommon. It is often associated with genetic syndromes that runs in families. Anaplastic thyroid cancer typically affects individuals who are over the age of 60. It is a very rare type of cancer that can grow and spread quickly to other parts of the body. It accounts for only about 1 to 2% of all thyroid cancer cases. Thyroid cancer can present as painless lump swelling in front of the neck. Neck lumps are quite common. However, most of them are not cancerous. Only about 1 out of 20 thyroid lumps or swellings turn out to be cancerous. A neck lump is more likely to be cancer if it feels firm, if it does not move around easily under the skin, if it gets bigger with time. It's important to see your doctor if you have a lump at the front of your neck. While it might not be cancer, it is important to get it checked out. Other symptoms of thyroid cancer might include swollen glands, that is, swollen lymph nodes in the neck, hoarseness of voice, pain in your neck or throat, and difficulty in swallowing. To make a diagnosis of thyroid cancer, a doctor will feel for changes in your neck and the thyroid, and this is followed by blood tests such as thyroid function tests and ultrasound imaging of the thyroid and the neck. And based on the findings, doctors may decide to do a biopsy of your thyroid gland. This involves taking a small sample of tissue from your thyroid and looking at it under the microscope. If diagnosed with thyroid cancer, further tests may be done to determine whether the cancer has spread outside the neck. This would include tests such as CT scan, an MRI, or nuclear imaging tests. Fortunately, most thyroid cancers can be beaten with treatment. Treatment will depend on the tumor size, the stage, and whether the cancer has spread. The major forms of treatment would include surgery, radioiodine treatment, external radiation, chemotherapy, and targeted therapies. Surgery is the most common form of treatment, and depending on the size and location, part or all of the gland may be removed, as well as lymph nodes where they have spread. For radioiodine treatment, you swallow a pill or liquid containing a high dose of radioactive iodine. The radioiodine shrinks and destroys the diseased thyroid gland with cancer cells. External radiation therapy uses a machine to deliver strong beams of energy directly to the tumor site, while chemotherapy drugs kills cancer cells and stop cancer growth. Very few people diagnosed with thyroid cancer will ever need chemotherapy. Following treatment, if some or all of your thyroid glands were removed, it may no longer produce thyroid hormones. That means you must take a replacement hormone tablet for the rest of your life. Regular checkups are important. This is because thyroid cancer can come back after treatment. You will be asked to attend regular checkups to look for signs of this. What next? Connecting with other survivors. Talking with people who share your situation can be very helpful. Keep your body healthy during and after treatment. It is important to eat a healthy diet with lots of fruits and vegetables and to get enough rest. Engage in physical activities when you can. Being diagnosed with thyroid cancer can be frightening, but take comfort in the fact that most cases are treatable. You can learn more about your disease on the British Thyroid Association website using the link on the slide. Thank you for watching.